To do this interview with me, and I know we have tried this 4 times now.
That sounds about right. At least 3.
I think this is probably one of the only times I've had to be between my mom being sick and different things. I'm so sorry because I'm excited to do it. And when you texted me and we're still on yesterday, I was like, yes, this is actually happening. We're both here. Yeah. But I wanted to share with our audience just what you do and really how much you've helped me, but also to kind of help as women, help us understand what is going on in our bodies at different times. And I know I work with a lot of people in different seasons of life, young women who are having fertility issues to PCOS and all the way into postmenopausal. So I think your experience of what you do, being able to share in each season of someone's life. And what does it even mean to be a pelvic floor specialist? Because when you and I met, that was new to me. And yet I thought, the more I researched, I was like, oh, this is something that I need in my world. And so, are you looking for answers, searching for natural ways to support your body, or frustrated with mainstream solutions? So are we. Welcome to the Renewed Hope Wellness Podcast, where we're on a search for answers. We're going off the beaten path and diving into natural solutions to health and wellness issues. Our goal, empower you to be your own health advocate. So let's get started. Have you been a physical therapist and then the pelvic floor specialist?
So I've been in practice for 4 years, and I've been in a pelvic health specialty that entire time. So I went ahead and did my women's health training while I was still in school. I went ahead and did the additional certifications so that I could come right out the gate and start with women's health, essentially. And then that brought into pediatric pelvic health within just a few weeks. So in regards to your question about what does pelvic floor PT look like, or what can it address throughout the lifespan, I guess I'll go in chronological order. So when it comes to pediatrics, typically the most common issues that I see are constipation and bedwetting. Constipation is the largest one for sure. A lot of children, especially in the US with our diets, are constipated. And bedwetting, if it is not necessarily age or hormone related, it is typically because of constipation. So it is a lot of nutrition based education. It really is primarily educational based, and then there's some kiddos where I am having to work on what does pelvic floor coordination look like, gross motor skills, core strength, things like that, how to actually poop on the toilet appropriately. Sometimes, since there's not necessarily a pelvic health OT in the area, I'm having to work a little bit more on toileting avoidance type things, where children are afraid to use the toilet, it's loud, so I have to kind of dig into some of my more OTs type of skills to work on that. That is what most young kiddos look like. For adolescents, I'm usually starting to work with girls who are either having pain with putting in tampons, or I'm having girls who have painful periods, or stress incontinence is actually very alarmingly common among female athletes. And so there's actually a huge, and I can't remember the number, but there's a huge percentage of middle school and high school female athletes who have leaking, but they don't talk about it because it's embarrassing. So I tend to see those patients for that age bracket. And then once you're getting into more of your like menstruating years, then I'm looking more at, pain because of endometriosis, hip pain, back pain, working on, symptoms like leaking and pain during or after pregnancy, things like that. A lot of women during this age range also come to me because they have hip or back pain that they've tried treating with traditional orthopedic PT or chiropractic care, and it's not working. And in a lot of those cases, it's because the main driver or a missing piece of the puzzle was actually coming from pelvic floor. So there's one very well-known study that was done several years ago that showed that 90% of women with low back pain have some form of pelvic floor dysfunction. And think about how many women have back pain. And so there's a huge correlation there. You know, if someone has a history of fallen tailbone, stress incontinence, hip pain, back pain, those are all indicators that there's likely some pelvic floor dysfunction that needs to be addressed. Once you get into like the postmenopausal years, I would say I tend to see where leaking that they had while pregnant or postpartum has suddenly worsened now that tissues don't have as much estrogen. They're losing some muscle bulk, they're losing bladder elasticity. So I tend to see where it's like symptoms that they had at a different stage of their lifetime has either worsened or it's come back. The other things I see there are pain with sex, again with low estrogen and tissues become a little bit more fragile. I tend to see painful sex or even just feelings of friction and chafing and general pain and discomfort in the area. Those are kind of generally across the lifespan the differences that I might see.
Wow, that's a lot to cover. I think I'm going back to the bedwetting. I think that's something that is not a connection that's often made with children. We sometimes think maybe emotional components or there's other things going on, which because we are one whole person, there's always many different things going on. But to just realize that it could be structural and that is not, and that's just such a hard time for kids, especially if it's gone on longer than accepted and just not like what's going on, what is wrong here. So I think that's amazing to think about that as a form of therapy as opposed to really what doesn't work a lot of times, you know, and being able to have somebody have just some changes in that movement. I think too, as far as like pelvic floor exactly, I kind of think of that as like an elastic flooring, and you correct me because I'm not the expert on this by any means, but when we think about pelvic flooring, that's holding up all of the organs that are so very important. And so as we age and our collagen begins to break down due to wonderful estrogen leaving the building at times, I think you really touched on something that like a lot of young women are not talking about, the fact that hey, this is happening to me. That's an old lady problem. Like I'm not going to tell anybody about this, but just the way we're made to be able to jump and to do things in athletics, it's like if you think about like a little trampoline in there, you know, so there's a lot, I think, to just let young women know too, this is not, you're not broken, there's not something wrong, and there's actually, if you support the muscles, that entire elastic muscle, then you're able to keep all of the bladder and everything up. Is that kind of am I headed in the right direction?
Mostly. What I would add is that I think that's where I differ from some pelvic PTs that I've known, is that you cannot treat the pelvic floor in isolation. So even though the pelvic floor may be a driver of symptoms and it needs to be addressed, rarely is the issue ever only found in pelvic floor. And so that's where you have to take that full body approach. So for instance, you know, if we're talking about the middle school and high school athletes that are leaking, so you know, your runners is what it often is. So what is going on at the pelvic floor could be a lack of coordination. It could be that it is so tight that when you need a little bit more oomph with a foot impact or landing, it's not there. But also, are they having issues with their landing mechanics, their foot mechanics, their spinal mobility, hip mobility, other forms of shock absorption? Are those working well, or is there something that is an issue there that's causing the pelvic floor to have to work overtime and compensate? And so that's where you have to look at the entire picture. It's never just one thing. Unfortunately, not that easy.
It could never be just one thing. That'd be way too easy. And just thinking about that as far as like, because everything's connected, like hip mobility being connected to that. I know when you and I worked together, was having a pretty big shoulder issue, which actually was causing some issues with the hip, and so I thought, how in the world is this related to pelvic floor? But just the muscle structure and just being able to actually be able to reverse some of the things. And I think, what does the role of estrogen play in that for women? So if someone has, let's say, PCOS and they have estrogen dominance, but they don't have the progesterone availability, often would you say that they need to work on pelvic floor a little differently, just because it is a whole life approach to getting well? But would you say that that plays a pretty big role in that, if someone came and that piece is missing?
So it can. So generally speaking, as you know, estrogen increases muscle strength and it decreases muscle and tendon and ligament stiffness, i.e. it makes them a little bit more flexible, pliable. So, you know, when we're getting into, I'm going to go towards the other end of the extreme, is when you don't have estrogen, then you tend to lose muscle bulk and things start to get stiff and tight. So the tendons and ligaments don't have as much of that spring component that you need. And versus, for instance, endometriosis patients that have really high estrogen, or sometimes your PCOS people, they're having that estrogen surge before ovulation, then they can have a little bit more discomfort because they're overly flexible, but maybe they lack some of that muscle stability or muscle strength to help compensate for it. From a general standpoint, I don't tend to find that the high estrogen is as detrimental in terms of pelvic floor health. You know, obviously when we were talking about, you know, inflammation and endometriosis and those kind of things, sure. Definitely the low estrogen is very, very, you know, it strongly affects pelvic floor health. I would say that in terms of estrogen and pelvic floor, the issues I tend to find are either people that are really low in estrogen or people with a connective tissue disorder that are overly sensitized to, where they're going to experience more of the fluctuations and symptoms with fluctuations in their cycles, compared to someone without a connective tissue disorder and PCOS, maybe won't have as much of those connective tissue fluctuations driving symptoms.
Oh, that makes sense. So people with like Ehlers-Danlos and like connected, that's going to be affected with that, just because
very much more
connective tissue.
Yeah.
So again, that whole life piece for everyone of like, what's your nutrition like? What's, you know, what are your supplement needs and things like that, and being able to have that. And do you feel like as estrogen declines that that's where women tend to have, well, more leakage, because everything changes in there? But would you say that pelvic floor, like as far as rating someone, if someone came in, you're assessing like how bad is this? Is this something that is a 1, 2, 3, or 4, or whatever scale you use, and being able to reverse that, which I think is the importance of people recognizing that although it may be considered normal to have leakage and to have painful intercourse, common, but as women we tend to just ignore things until they're not, they get our attention louder and louder, and the body has a beautiful way of doing that. If we're not listening, it just gets louder. And so I'm learning it pays to just listen in the beginning when it's a whisper, but I think we just as women often don't take care of those things because it's maybe not happening all day long, and you're not completely incontinent, but those are the things that I always encourage people to come to, because I'm like, let's get ahead of the game
before it's a huge deal.
Prevention is always going to be so much easier than trying to fix it, and it's not that some things I don't think can be maybe so reversal, but once you have atrophy, and it affects everything. I mean, a lot of women don't enjoy sex after a certain age because it's painful. And a lot of that has to do with these very things. And also, in order to be really candid, for orgasms to happen, you have to have a good pelvic floor system. Otherwise, you have a very weakened experience. And when you couple that with hormones that are leaving the building and libido that's saying goodbye, it just makes it
goes on the back burner.
It does. And I think a lot of women just feel like, well, that's just part of aging. You're not going to be able to enjoy sex anymore. That's just going to be, that's just part of your younger life, you know. And I think if maybe we took care of the way that we're made, and we learn to address things earlier, that it would make everything a lot better. And that you don't have to be resigned to needing to wear the pins. No shame in that. But if a lot of it's surprising now how young women are, that they're having to go to something that was really more of an elderly community age group. So I think there's a lot of just kind of sometimes getting a boost of saying it's part of self-care.
Absolutely.
Which we don't always do.
Well, and it's also difficult because I still hear from a lot of patients that they've been leaking for a long time, and they brought it up, since they had, first or second kid, and they bring it up to a medical provider who says, oh, well, of course, you just had a kid, leaking is normal. It is what it is. And again, common is not normal. Diabetes is common. We all agree it's not normal. Same for leaking. That is a sign of dysfunction that deserves to be treated, that needs to be treated before it becomes a much bigger deal later in life. So I think that is part of it too, is one, the regular person doesn't realize that leaking is not normal, and two, some, not all, but some medical providers, physicians are enabling that logic of, well, sorry, it is what it is, and it's not that way. So
especially when you don't know what you don't know. You don't know that, hey, that is not something that I have to just be resigned to. And I do think people being more aware of, like, when you sneeze, if you're having leakage, that's not normal. Even though, as you've said, it's common. And that would you say that, how difficult is it to help someone the later they wait?
Oh, it takes so much longer than, I have been lucky enough to have some patients that are very body aware, body conscious, and as soon as they have a symptom, like, let's get this knocked out. So I've had some patients come in within just a few months of developing, back pain or some prolapse symptoms, or maybe a little bit of leaking, and those get cleared up so much faster than the people who come to me like, well, I've been leaking since my first kid. Okay, how long ago was that? Oh, 20, 30 years ago. Okay, we'll fix it, but it's going to take some time, because it's going to take a lot of unraveling who was contributing after 30 years. There's going to be a lot going on.
Well, and the way as far as the lining in our bodies, is when you do have that drying and that atrophy. So a lot of women they're scared of hormone replacement, because we've been taught to be scared of hormone replacement. And the studies that was based on are so archaic, but they're still being taught, like the 80s studies that were so jaded and one-sided. I mean, you take a huge group of 65-year-old women, you don't do any testing, you put them all on a synthetic progesterone. Well, it was just what you thought it would be. A nightmare. But that's not at all what it is to have a bioidentical body, just like our replacement implants, and to have some of that fear taken out, because sometimes you just need a vaginal estrogen cream.
A lot of times.
And it's life-changing, especially for women who are having painful intercourse. And if it's not just pelvic floor, sometimes it's just the beginning of saying, if that can get in place, you don't have to ever go there with all of this. But I think there are things in women's health that are taboo. Like, it's still very common to be afraid to replace a hormone. And I do think that I'm very conservative about that,
Sure,
and I think that people should be. We're not trying to restore hormones back to when someone was 30 years old. But some young women don't have. I mean, they have levels of, when we test them, of postmenopausal levels in their 30s, and that's like, well, what is riskier? To do without hormones altogether, and assume all of the problems that come with that, which are many.
Yeah, because then you lose the cognitive protection, the cardiovascular protection.
Yeah, dementia. The rise in dementia among 50-somethings, which to me hits home, because I'm like, for me, when I look at women considering hormone replacement, and you're looking at painful intercourse, low libido, like all these things that we start looking at quality of life.
Right.
But then you start thinking about your prevention of Alzheimer's and dementia, because that beautiful hormone estrogen is not only supplying the pelvic floor and the collagen and everything there with that elasticity, it's providing everything.
Every cell has estrogen receptors.
And so it's like, well, we swing so far. It seems that we're in this country, we're one way or the other, and there's like no in between. But I think helping women see that what you're going through, if you're leaking, if you're having painful intercourse, those are things that, you can keep going with that. But a part of self-care, which is kind of when I came to you, and you had came by the office, because I was so glad that I was like, there's someone awesome in Hayesville. Like we have someone that we're actually going to be able to not have to drive 2 hours for. And then we met, and of course I loved you from the beginning, but I really appreciated that you were just so knowledgeable, and just made that as least weird as possible, which I think is something important too, because I mean, I've had children. This is all like, we're grown-ups here, but at the same time, you're like, you actually do a pelvic exam. So I know that I have had several people say, oh, I've done pelvic floor health with a physical therapist, and I'm like, did you have an exam? No. So what's the difference in that?
I won't name names, but there are some clinics that they have a provider who likes to work with women, and especially usually think like the pregnancy, postpartum, but they're not trained to do a pelvic exam. So they're working more on core strength, glute strength, things like that, which is fantastic. Lifting mechanics, or being able to bend over, pick things up off the floor, pick up your baby, which those are all completely necessary. However, you can't call, or you shouldn't call yourself a women's health provider, or a women's health PT or pelvic PT, unless you're actually assessing the muscles that you claim to treat.
That's kind of like, to me, and I think that's what I've tried to help people just understand. There is a difference. Those things are very good. Those are exercises.
Absolutely.
They're extremely helpful.
Right.
But how can you really assess something that you're working on, an organ, a system in the body, if you're not familiar with it? And I think a lot of times, my hip issue, I just think of how many women are dealing with gluteal tendinopathy, and things are tied in the wrong place and not where they're supposed to be. But how connected all of that is, and how if you don't have someone actually involved in that examination, I don't feel like I would have benefited as much from it. Not that the exercises might not have strengthened the muscle some, but I think that's
about a full picture.
Yeah, it's kind of like, to me, psychiatrists are the only providers that never look at the system that they work with. They can write all the prescriptions in the world, and they can give you all these theories, and I'm like, Dr. Daniel Amen, he's looking at the brain, but overall it's been like, how do you really know something and know how it's working in someone unless you can check. And so I think that difference for you, and I think I didn't know the difference.
People don't.
No, what's the difference in, it's PT for pelvic floor? I can go anywhere and do women's health, but it's like, well, there's a big difference.
There's a big difference. And even for people who are doing an actual pelvic exam, there's still even more nuances there. So, for instance, a lot of pelvic PTs who have done some of the more traditional go-to certifications for public health prioritize what's called biofeedback. And it's where you put these sensors on the perineal area, and it's to help, what it's supposed to do is look at how much muscle activity there is. So obviously really high reading means that there's probably high tone, muscles are gripping, versus a low number, muscles are able to relax. And they often put this on, we'll have people practice like just contract, relax. However, it's not functional. When you are running and leaking, you're not laying on your back just doing Kegels.
Yeah.
And also something just like your the high-low table that I plug into the wall, just the electricity running through there can throw off the numbers of a biofeedback machine. So it's like, is it actually telling you the information? Yeah. So it's not even all that accurate. It's not functional. So even if someone does a pelvic exam, it's like, oh, you're too tight or you're too weak. A lot of times their treatment for that still isn't quite enough. So even when I lived in Fort Worth, where there's lots of pelvic PTs relative to here, I still tended to get a lot of patients that went to other pelvic PTs who may have done an internal assessment, but their treatment, they weren't testing them and treating them in the activities and positions that were actually giving them symptoms. And that makes a big difference.
Yeah.
Laying on your back is not the same as running and jumping.
Absolutely not. Yeah. And I think that's how a lot of women do run. I used to run and do ultras and stuff, and I loved it. It was how I managed to stay sane during a very weird time in my life. I was raising all my children, which I love, but it helped me have like an outlet.
Yeah.
I did it all wrong. I didn't know how to do it right, and I would probably, my younger self wouldn't have listened, but I wish I would have known.
Yeah.
But that was really where I started experiencing some of that, because the way that we're made as women makes it a little more difficult to run and maintain pelvic floor health, because I was just kind of going.
Just go for it, yeah.
Just go for it, and then you deal with whatever, which I dealt with for a while after that. And it actually, I think knowing that you can still run, you can still do those things, and that, you just have to be able to work that muscle group just like we think about every other muscle, which no one ever talks about.
Nope, never.
So someone had mentioned to me doing Kegels, so you had mentioned that, or maybe just going on YouTube and doing pelvic floor exercises. And I think, just like you said, I think there's probably some benefit to that. I think any muscle that you commit to do some work on, you're going to probably gain strength and some. But I think Kegels for a lot of women are like, well, it was just painful. Like, or they were doing some of those little, the little inserts or different things. What would what's your feedback on that? If people are maybe not able to get to you because they don't live in this area, or they can't find someone, I would encourage them to hopefully find someone. But do you feel like those can be harmful because it's not taking into account the hip and all the rest of the body? Or what would your advice be for people on that?
So generally speaking, when it comes to doing Kegels, a lot of women are actually tight and weak, not just purely weak. So if you think about when you have a knot in your upper traps, how painful it is to contract it, and then it usually makes you feel tighter later. So a lot of women are over here saying, I think I'm weak because I have leaking, or I have incontinence of gas, or what have you, or prolapse. They assume that they're just weak, and they do a bunch of Kegels, and their symptoms get worse, especially leaking. I tend to see that with leaking getting worse, and it's because if you're already really tight, then you're going to be a little bit weak because you're fatiguing very quickly. You're already fully contracted. You've lost that trampoline mechanism. And so for a lot of women, I do see I tried doing Kegels, or my doctor told me to do Kegels, and it got worse. That's usually that case. If we're talking about someone who's just purely weak, so this is usually going to be your postmenopausal, low tone, low muscle bulk, those kind of things, maybe generally relatively inactive, weak glutes, weak core, just everything is fairly weak and low tone. Could Kegels help? Potentially, but then again, you're losing that functional aspect where it doesn't necessarily help just to sit and do a bunch of Kegels. What helps is, okay, why don't we put it into a full system? What is your pelvic floor doing with a squat? What is your pelvic floor doing with a sit to stand? What is your pelvic floor doing with a glute bridge? When you pick a box up off the floor, more of the taking the full body and functional approach. You never strengthen your biceps just by back and forth, back and forth, back and forth, no weight all the time, right? Like there is some kind of training stimulus. Or glutes, just squeezing your glutes together, just squeezing your cheeks. Is that going to lead to functionally strong glutes?
I wish it would.
I wish, but no, you know? And so that's where I would say Kegels are not all bad. I have some patients that I'm like, okay, I want you to do a Kegel during this specific phase of an exercise to help pull prolapse up and in, but I've already made sure that they're normal tone, they know how to both contract and relax, all the things. Their core strength is great, their their glute strength is great, all those things.
Yeah.
So.
Wow. And I think too, just self-help, you know, we have so many things available to us, which I'm thankful for. I do lots of different YouTube things, but I think sometimes just if you've got real issues and you know you're having leaking and you're having things, I think the value of being able to have someone just look at that and say, okay, what do you need? And I think for me, a lot of what we did was the physical therapy of like, what's it like when you're doing squats in your normal life? What's it like when you're doing things? Talk about tough. That's some of the hardest, like I've done some pretty, I mean, I've probably messed them up, but a lot of tough workouts. But any kind of like PT stuff was really hard for me because I lacked the discipline for small movements. And my patience in it. Like I like to think I'm doing something, even if I'm not, like with weights and all. So I think for me it was just, but then like to have the discipline to do my exercises, and they only took like 3 to 5 minutes. It was ridiculous. I remember being like so embarrassed. It's like, I don't even know if I can tell you that it didn't have 3 to 5 minutes. And you were always like, it's fine, I understand. So, but I was amazed that those small amounts of time that I did end up finding in the beginning really well, how much difference it made and how it literally fixed. And I didn't even really, I don't feel like, because we had some things going on in our life and stuff just got postponed, but I think I still have those exercises, but I think it made a difference in a very short period of time. So I'm 50 years old, so it's like, I waited a while, you know, but it did seem like the body is just so amazing how we can.
It's very adaptable and resilient.
Yeah, unless you're doing something stupid all the time and you don't know it.
That's true.
So, and how many times I think I've done a lot of like the PT, like the pelvic floor workouts and stuff, like following along. And I think now when you assessed, and I had a hip issue and I had a neck issue, and I think this was probably not helpful, and I spent a lot of time on that. So I think being able to just, for me, it was hard to take an hour. I have a busy life, as everyone tends to, but for me it was my first step of like taking care of myself. And I think that would be something that I would want women to say, absolutely, this is, one, it's not normal, and two, I don't have to give up years of my life to something. I could see someone an hour a few times a month, initially maybe not even that many after that, but to just think that we don't really think about taking care of our bodies, ourselves. You know, we might eat good or we might do things, but I think definitely that was just amazing. So I send a lot of people your way, and they are so glad when they go. And a lot of women that are facing needing to have bladder mesh put in, they have waited a long time, and I'm always like, let's see, I wonder what your body could do if it had half a chance. And I think it's amazing to see that sometimes you can avoid a surgery. You could definitely avoid a surgery, which is why mine was nowhere near like my issues of what I would consider bad, but I also thought, I know what I don't want to do.
You don't want to get to that point.
Because I care for a lot of patients that have gotten to that point. And once you have bladder mesh, and I have a lot of experience with clients who have that.
Right.
You get other, I mean, it's not an easy solution. It's not an easy fix.
No.
But then you get some, like the likelihood of UTIs increase and like candida and overgrowth. And so it's like if you never had to go there and someone just said, hey, did you know?
Right.
There's a person that can
help you. And something to keep in mind too is even if the issue is, say, that there is a bladder prolapse and that is contributing to frequency, leaking, dribbling, heaviness, things like that, the surgery doesn't fix what issues are coming from pelvic floor, i.e. like a coordination, like a strength, or hips. It doesn't address the full picture, so I still
supporting it from above.
Right.
Yeah.
And for a lot of people, one of the reasons or one of the contributing factors to prolapse is things like constipation, or instead of engaging cord correctly, pushing down, almost like you're having a bowel movement. And even if you have mesh, if that continues, I see a lot of people with a failed bladder sling surgery because they never were taught how to reverse those bad habits that led to a worsening prolapse in the first place. Other things are, I guess, my soapbox, something that really grinds my gears is you would never find an orthopedic surgeon who did not recommend or require that their patient went through a full round of PT before having a knee replacement and rehab afterward. Those are a given. Prehab to go in stronger, rehab afterward. Why is women's health not treated the same, right?
Yeah.
So like for instance, if you're gonna have a baby, why are you not getting PT during pregnancy? Even if you have no symptoms, you're about to go through a major life-altering event. You're gonna need the strength and ability to pick things up off the ground, get up and down from the ground. You gotta know how to poop and stay regular right after.
To not have leakage, that's
not have leakage.
Normal.
Yeah, exactly. And so like, why are we not doing it for that? Or if you're about to have even if you are about to have a mesh sling inserted or a tummy tuck or something like that, why are you not having prehab first to get your core, your pelvic floor, all those down, get your bowels healthy, learn how to fully empty bowel and bladder? Why are we not doing that first? Even if you need the surgery, to go into surgery as strong as you possibly can and then have rehab afterward. It's just backwards thinking where when it comes to any other condition, prehab and rehab, but when it comes to women's health, you might get rehab if you're lucky. Yeah. Definitely no prehab, but probably not either one.
Yeah, and I don't know, it seems like it's that way, and you hate to just be like, what is it? Because I think as a whole, the way that the medical system, and not to be critical, because that's one of my soapboxes too, but is why do we, as a whole, we wait until something is so broken that you need medical intervention, drugs, surgeries.
Yep.
But like you said, in between that, it's like there has to be a better system in place.
Right.
Because otherwise we're just making sicker and sicker patients, or people who have more injuries and more surgeries are needed, which is kind of like that circular loop where an ounce of prevention would definitely change, and to just say, what we accept as common, it doesn't have to be something that you go down that road, but I think it's the way Western medicine is done. It's that, one of the frustrating things that I do is try to fight with providers about saying, let's get some labs done. I don't know, let's look at those numbers, because I'm a black and white numbers kind of person. I like to see
quantitative, objective data.
Because the patient can measure success or not, and so can I, as far as how am I doing. To me, it checks both the patient and the provider, because you want to know if what you're doing isn't working.
Yeah, absolutely.
But what I face all the time is, well, we need a diagnosis code for that. We need a disease in order to prevent. And I'm like, but that's not what we're doing. We're trying to prevent the disease.
And optimize health before that point.
Yeah, which gets you into why I don't accept insurance. Like those kind of things in a lot of practices, which I know for some people, they're like, well, that's out of pocket. I have insurance. I would like to use my insurance. But you have to it's starting to become more difficult to be someone who is seriously proactive about your health.
Right.
And be able to utilize your insurance. It's really for sick people.
It is.
And I think we have to get out of this mindset that, it may cost you a little money to do something right now.
Sure.
I mean, I think what I spent with you over the course of a few months, I'm like, probably not ever going to need a bladder sling. So, so how much have I saved? Not only on that
not
side.
even meeting a deductible, which you'd have to pay for surgery.
Yeah, but I think it is, and I do get it. Times are, financially taxing for people, but I think you have to start seeing you're the only one as an individual who is in your medical world. If you're just in allopathic care, you are the only person that really cares about preventing what's going on with you to the degree that you would change something. And I think that we have to start becoming very proactive advocates for, yes, I want that lab. I'm willing to pay for that. And I think that's where I am. I have insurance. I pay for my own labs. The reason is that I know I want to have some things drawn that matter that I'm not going to be able to get done through insurance. And so I know that more and more providers are stepping, even in the MD world, they're stepping out of that insurance model because you can't help people as much. And so I know I always say that as people call. Sometimes people are like, oh, you don't take insurance. And you almost feel like you need to be apologetic. But then there's this whole other side that, well, we also don't have to charge these exorbitant amounts because we don't take insurance. And really what it costs you to do preventative health care. I mean, often people will, they'll say, well, it's expensive to eat healthy. I'm like, it's expensive to have disease.
Even more so.
And it's just that I think we have been kind of conditioned to think that we just do life until we have a sickness or a disease, and then we're going to get really busy trying to treat that.
And backpedal.
Yeah, when it's like, no, wait, what if I didn't have to ever be there? And I mean, I'm not saying every person that's proactive in their health doesn't have issues. It just means that you're better prepared to face something. As far as maybe you don't have to have a bladder mesh, maybe you don't have to pay the cost of wearing, something to help with incontinence. No shame in that, but it's also like it's hard for yeast infections. Like there's certain things that make it difficult. So I'm like, well, what if you never needed that? Because I think the body is so able to heal that we can prevent so many things, which is. I think coming together, and in our community, we're starting to have a lot of women that are helping in different ways, that just helping people, whether it's through counseling or through whole life approaches or functional medicine or pelvic floor, where we're starting to say, you know what, this has been overlooked in a man's world, not to get, but where you don't understand something. I can't compare my sex drive to a man or anything else because they have a totally different system. And I think that's where sometimes just having someone who understands where you are, that hey, that's common, but it doesn't have to be. So
and piggybacking off of about insurance and how being outside of the insurance limitations, while it might be a little bit of investment up front, the long-term benefits, I've had a lot of patients that have been to an insurance-based pelvic floor PT, and insurance suddenly decided that they were well enough and didn't need more, but they were still having their symptoms. Were they reduced? Yes. Were they gone? No. And that's where I think, you're done. You're good enough. You can function. That's it. That's all you get. And it's like, well, why is the bar that low that you're just going for minimal function instead of optimizing health and feeling like your absolute best that you possibly could feel? If I don't know if you've been to insurance-based PT before, but when you go for a script for your shoulder, they're not going to be looking at your ankle and foot. They'll say, I need another script for that, and we have to do new eval for that. Versus, since I'm not in outgrowth insurance and I'm direct care in North Carolina, I don't have to do that. So if a person comes to me for leaking, I can also connect the dots between, oh, hey, you're also having neck pain and headaches a lot, and your foot bothers you and prevents you from running all the time, and you're coming to me because you leak while you run. Well, why not address this too? And look at the full body of optimal health and not just like good enough.
Yeah, because I think it's the medical model is every part, every system gets somebody else involved.
Right. Until
we wonder if we're even one person anymore, because you have a specialist for this and a specialist, it's like cutting up an elephant and sending everyone a different part and saying, fix this.
Good luck.
Yeah. And it's just, I think that until we start seeing people as whole people, like being able to say, like I said, I went to you for one thing and actually have had no issues with my shoulders since I went to you for something else. So, so I think being able, which a lot of what I do too, is saying, okay, you have all this stuff going on, maybe all these diagnoses, but let's clear the muddy waters, because you're one person, and what do we need to attend to first? But in that, it's all connected. We're not going to be able to get away from that. And I think people are getting frustrated with feeling like they've been specialized out, which specialties are awesome. You're able to just focus on one thing. The problem with that is that specialty doesn't connect with the other specialists. And so you're one person with this disease that has to go to this person for this, and no one even knows who you are anymore. And I think that's where having someone on your team that says, wait, I know you have a cardiologist and an endocrinologist and all these different things, but let's look at you. What are you taking? How many of these got together on that? And that should go on, and I think it does sometimes. But I'm always shocked a little bit at how it's like that. Well, you came to us for a shoulder repair. We can't help you on that pain you're having. We'll rewrite a new. Maybe you'll get a script for that.
You're lucky enough.
And I think we just have to do life differently. And if we want to have that, because there is a difference in, like you said, you're making it, we've got you good enough, you're good, let's check that box. But I think that's what we sometimes do to ourselves too, is well, I'm just leaking a little, I can't sneeze without crossing my legs, like there's just like, that's just so fine, and you're not gonna die from that, but what if you didn't have to? It's definitely a lot better on the other side of that,
for sure
than having that. But so you are in Hayesville, and your office is there, which is Appalachia, not Appalachia, Pelvic Health and Wellness. Did I get that right?
Yes, you got it.
And so you have an adorable little office in the little downtown.
Well, it's actually changing next week.
Is it really? Yeah. Are you moving to a different spot in Hayesville?
Yes, so it's moving into what was formerly the Jackie Jones Imports building on 69 between Hayesville and the Harris-Hiawassee stop
we're closer to you.
So essentially, my husband and I have spent the last month every weekend renovating, and we'll move everything over this weekend and start seeing everyone there on Monday.
So you've been busy.
Very much so.
And you teach at Young Harris. So kinesiology?
Specifically, I'm in the kinesiology department, but I specifically teach exercise physiology.
So which is really amazing too. And I think that's where, like with the dry needling and different things that you've been able to pull into your practice, which helped me so much. I think, and you do you do general PT care as well, or is everything more driven for women's health and pelvic floor?
I would say that, again, since everything is connected, every pelvic health patient is also an orthopedic patient. So like I'm an orthopedic PT first that has dived into pelvic health. You have to have ortho skills to have pelvic health skills. So I still treat shoulders and hips and backs and necks and feet every single day. And other people, I would say most of my patients find me because of a root pelvic health issue. I once in a blue moon have a very well-educated patient who's like, you know what, I've done all the normal things, PT, chiropractic, all massage for my hip and back, and it's not getting better. I wonder if it's pelvic floor. And so I get some of those. And then I have some patients who call and like, hey, you saw my friend or my family member, and this isn't necessarily pelvic health related, I don't think, but can I come see you for this? Right. And so I do get some one-offs that are just coming in for a neck or a shoulder, even though it's not like necessarily pelvic health. They just heard that my style of care is what they want, and they come and find me that way.
Yeah.
So,
well, that's good to know, because if anyone's kind of interested and thinks, well, I don't really have that going on right now, keep it in mind for later, but because it's all, we're going to struggle to find anything that's not connected, right?
Yeah, pretty much.
You have to cut it off first, and then you can say, okay, now
it's not literally not connected.
Yeah, for sure. So, well, thank you so much for your time.
Yeah,
maybe
absolutely.
We can not have to postpone it 4 different times and we can get on the call again. But if anyone wants to reach you, you have a website that we will post in the description. And so do you have that readily? So if someone wants to jot it down, what is your...
What is my name? I'm pretty sure it's just www.appalachiapelvichealth.com.
And it's Appalachia,
no
not
N.
the N on the end, and you guys can find that online. I mean, Google search on there just to find you and be able to schedule and see if some of this normal common stuff can actually be resolved.
And optimized.
Well, thank you so much.
Yeah, thanks for having me.
Thank you so much for listening. If this podcast inspired you or encouraged you in some way, please leave us a review or share this episode with a friend. If you need help connecting the dots of your own health journey, I would love to help you with that. You can reach me via the link below to set up a one-on-one consultation. You can also connect with us by joining our free Facebook community, which is linked below, or at healthywithhappyspurling.com. Until next time.